Before I begin, I'd like to acknowledge the other advisors who I know some are in the room. Can I ask all the patient advisors who are here with us tonight to stand up just for a minute, please? As we heard before, these individuals are volunteers. Volunteers who dedicate a great deal of time, not because they have to, because they care and they are passionate about what they do. Allow me first to say thank you to Health Sciences North for this opportunity to speak at the annual general meeting. This is the first time that a brief patient report has been included at the AGM. This is just one example of how far we have come. The Patient and Family Advisory Council was created in the fall of 2012. Today, we have 3 councils and a total of 47 patient and family advisors working with the team here at Health Sciences North. These advisors represent the CEO Patient and Family Advisory Council, the Northeast Cancer Care Patient and Family Advisory Council. They represent the Children's Treatment Center Parent Advisory Committee. And lastly, we have a resource pool of advisors available to us. It was approximately 4 years ago when I noticed an ad in the local paper asking for patients and family members to participate on the CEO Patient and Family Advisory Council. At our very first meeting, we shared with each other our own personal stories about why we wanted to get involved, why did we want to participate. We shared stories either about ourselves or our family members who had received care here at Health Sciences North. At times, these stories were painful and difficult to listen to. In fact, many stories brought tears to the eyes of several people around that table. I was one of them. Many of us had great things to say about the care that we or our loved ones had received. Most of us had suggestions on how we could perhaps improve upon the good work that was already being done. What was really interesting was that all of us had a common theme or message to our story. That common theme was communication. We wanted to encourage all the partners in our healthcare system to start to communicate with each other. And we had to somehow encourage patients and their families to speak up, ask questions, and get involved in their healthcare. We believed that this would change the culture of the organization and also change the culture how we interact with each other. Today, I'm pleased to report that we have patient advisors who are actively involved in a large number of initiatives and improvements here at Health Sciences North. Patient advisors recommended and played an important role in the decision to increase the length of visiting hours. We have patient advisors who sit on and participate on many different committees. As advisors, we have been a part of interviewing committees to select senior leaders. Who would have thought in just 4 years this would all be happening today? I mentioned earlier about the stories that we shared at each other at our very first meeting. Today, at most committee meetings, if not all of them, an actual, true patient story is shared with staff. These stories that are shared will help keep all of us grounded. And when I use the word us, that includes everyone in the healthcare system. It does not matter whether you are the CEO, a VP, a physician, department head, nurse, or frontline staff. When you hear those very personal stories, and when you actually listen to those stories and put yourself in those shoes, those stories will have a resounding effect on you. Patient-centered care truly involves putting the patient first. I can certainly appreciate that our healthcare system is very complex with many groups and many healthcare providers attempting to do the right thing. But we must begin the process of becoming open and transparent. We must begin the process of treating the person and not the illness. Putting patients first, for me, it means involving the patient and their family at each and every step along the way of their health care. Putting the patient at the center of the wheel, with spokes leading outwards to the many healthcare providers. This will inevitably ensure that patients are truly connected to their health. Ensuring that healthcare provided is in the right place, at the right time, and by the right provider. In just 4 years, I truly believe that as patient and family advisors, we have made a difference. And listen, I am under no illusion that this transformation will be quick, nor will it be easy. But I, as well as the other advisors, believe that it can and it will happen. The CEO Patient and Family Advisory Council will continue along with its work along with everyone here today towards our common shared journey of patient-centered care. It won't be easy, it will be hard, but we will do it. I'd like to thank Dr. Roy, all the members of senior staff, the many managers, physicians, frontline and support staff who have welcomed our suggestions, welcomed our contributions, but most importantly, welcomed our participation. I thank you all so very much.